insight, and from there to formulate solutions that are meaningful.
Yeah. And I think that's the key. First you got to identify where we're at. And then you've got to say, can we change? Can we pivot? You guys are certainly dramatically trying to pivot the whole space. Talk a little bit about Dr. Tang. We've talked about it before. I'm still not sure everybody wraps their head around what a DAO is, a decentralized, autonomous organization, much less one focused, giving sort of a democratized voice to people to change how healthcare is delivered or how they get information, all that, all in a place in space that we're all intrigued with, but I don't really know how to get there or what to do there, called the Metaverse. So talk about this strange structure you've created and this strange place that you've planted this organization.
So strange is actually a very good adjective, because it's something that's actually is going to be developed and actually evolve over time. So My idea of a DAO or my idea of a Metaverse is just my idea, but over time it's going to evolve. It's going to evolve with the help of you guys. So you guys are going to help us to sort of design a DAO that is actually effective and design the Metaverse that is something that's more intuitive and personalized. So DAO, as it stands now, is as you said, a decentralized autonomous organization, and it's basically a collective or a place where you can crowdsource information. So our DAO is made up of different categories of individuals, and it's biased towards the consumer, with around 56% of the memberships biased towards consumer, and a portion of that's going to be donated to underserved areas. Other portion is like medical professionals as well as allied healthcare professionals. So we're using it as sort of like a co-op or a place where you can actually, everyone will have the equal vote, and they will vote on different aspects of the eventual Metaverse. Initially, as we mentioned, is going to be a source for us to gain insight. So the initial few questions or queries are going to help us sort of figure out like what in the healthcare system currently works and what are the pitfalls. And from there, we'll design questions will help us sort of design a more intuitive Metaverse and a iteration that is more better received.
So break that down for me, Elaine. It sounds, I've used the analogy of a co-op. We all own something together. A group of farmers originally owned sun-kissed growers, and it was the way to market all their oranges together or something here. Or a building in New York, a brownstone, we all own part of it, and somehow we have a say in what happens in the building. Is that it? Is it sort of the member, as opposed to Facebook or Twitter right now? I'm a member of those things, but I don't get any say as to what they do.
That's right, exactly. Yes. So yes, when you pay $20 a month for Twitter, you don't own it, right? So the DAO is exactly that. I like the analogy of being the co-op on blockchain. So the reason why it's decentralized, it's because it is on blockchain, and blockchain is a decentralized platform. So it's managed, and the technology to manage the DAO is blockchain, and it's registered into the blockchain. So it is the modern version of a co-op. So yes, all people that are members of that DAO have an equal vote depending of their membership, obviously. Like, for instance, a consumer membership could give access to vote on certain sections that would be defined and develop, or voice their solutions and or voice what their concerns or would like to see in the medical metaverse. Then you have the doctors and you have the wellness. So that's 3 different memberships, and they have different level of voting rights. And these votes is when we bring, for instance, solutions, technologies, services that we would onboard onto the medical metaverse. The community, the collective, as Stephen called it, vote on it, and it's them that decide what will be transferred into the medical metaverse. So it is, in other words, our role as Dr. Trinh, Dr. Tang, and the other leaders of the DAO is to streamline that process as much as possible, to help build a skeleton of the DAO, but the meat that is being put on it is done by the DAO itself, by voting process.
So one of the things that I immediately have to ask myself, Dr. Trinh, is why give the consumers of this, if they are, a voice in what they say? What a radical idea. When General Motors designs a car, they do it and they tell me, here it is. And then I either say, nah, I like it or I don't. But I don't get any say in it. I might send them a comment and they might integrate that into future designs. But it's their company. They get to say what they do. This is your company. Why not just tell us what to do?
In healthcare and the way healthcare has been designed, the delivery healthcare has always been designed by those at the top. And what I mean by that is it's designed by an executive team with the board members and those who have probably values that may not align with the values of the patient. And so when you have healthcare that's being designed by a accountant or a CPA, right? That's often designed with the dollar sign in mind, maybe designed with the first value, which is profit, as opposed to health. When you have healthcare where doctors are only reimbursed if you're sick, then there's no incentive for prevention and wellness, right? So the patient in this situation oftentimes is like a pawn in this entire system. We want the patient's voice heard, and we need them. We need patients to design this in a way where the patient's values is at the top. And that's why this DAO, this decentralized autonomous organization exists, because we want that voice and we want the voice of our patients, as opposed to the voice of someone else with different values in the healthcare system.
So Dr. Tang, that's pretty radical in a world where I'm told to just shut up and sit down and the doctor will tell me what's wrong with it. He'll ask me some questions, and then I sit there quietly waiting for the word on high to tell me what I should do, what's the problem, what I should do, and then I'm dismissed. You may leave. Next. It isn't a cooperative discussion because I'm not qualified. I'm just the patient. I don't know. They know. And I think more and more people are pushing back on that idea, saying, well, wait a minute, I might know. I'm the one, I know my body better than anybody else. I think I know this isn't normal. I don't know that this is the complete answer. I don't know that I accept that there isn't a bigger holistic problem going on here with my diet or exercise or something else here. It may not just be my heart. It may be an indicator of something big here. And the doctor's like, well, I'm a heart specialist. All I can tell you is what's wrong here. This seems to be a radical departure from that model.
I think it's definitely a unique version of what healthcare should be. If you look at healthcare traditionally, healthcare has not changed dramatically over the last decades or centuries. It's always been more of a reactive care and more of like professional driven. So it's like top down sort of approach in terms of actually disseminating information. So, but has healthcare changed over that time? Have we actually created a better iteration where patients are happier and outcomes are better? So we have to ask ourselves that question. If you look at healthcare expenditures over the last several years, you see that it's only rising every year. Currently, it's estimated to be anywhere from 18 to 20% of the GDP. So is this a sustainable event? It's not a sustainable event. So we have to actually reimagine and sort of like look at different options and different viewpoints. It's our time as a community and as a country to sort of like take it and look at it a different way and see if there's a better way of actually providing healthcare. Is there a better way to re-engage a population of healthcare consumers who have been more apathetic towards healthcare, not engaged, not involved, and not taking like ownership for healthcare? Because if we take as a society ownership for our own healthcare and actually make lifestyle changes and choices at a young age, we can prevent chronic illnesses. So that's the whole iteration. That's the whole sort of vision of our project, is really changing it from where it should change, not reactive towards like chronic illness. Change it like when at 18 to 24 years of age or 18 to 34 years of age, let's re-engage that population, make healthcare fun, make it entertaining, and then make it more impactful for the future.
You even tried to come up with tokens and gamification, trying to make it fun in this space here. Maybe you win points for doing the right things, and you can exchange those for information or services even in the metaverse. Is that right, Elaine? Is even a fun component to this thing here?
Well, yeah, the metaverse provides the opportunity to do a little bit more gamification. And gamification is not just to have fun, because it is obviously much more fun. And it's something that the young generation, it's native to them. So it's easy for them to get into it. So it's an opportunity to educate while having fun. But it's also an opportunity to have games as a preventive solution to help, for instance, people detect certain problems that they have. We can and also stimulate the brain. So, for instance, Dr. Trinh has experienced the other day a game that helps stimulate the brain for people that have Alzheimer's. So it is possible to do things like that, but making it available to everybody and making them feel in a space that is human-like experience, even though it's in a virtual world, as opposed to alone at home, or having to send a machine at home to be able to do these kinds of games. You are able to host them into a semi-real world and be able to do so much from it.
So let me give you an example. Many years ago, like many Americans, I joined a gym with all the great intentions to use all that they had there to get healthier.
Yeah.
And I went once, and I felt stupid. I didn't know what I was doing, and I felt alone, and I felt uncomfortable. And though I continued to pay that membership for probably a year, I rarely went. And I thought, how foolish to not take advantage of what's there. And years later, I had to get a buddy, and then we all went, and then it became sort of a competitive thing. You're doing this and I'm doing this, and I push you and you push me. And there's something about competition, at least among men, that seems to bring out different behavior in people, or if I'm having fun, or if we're doing it together, as opposed to riding my stationary bike alone for hours and hours and hours. Does that play into that? It seems like you're trying to tap into lots of ways to encourage the right behavior in people.
And I'm going to throw something out there before I have to leave, and I'll leave it to Stephen because it's his specialty. But what if you are rewarded for doing your gym? What if you get tokens from just because you went to the gym? Maybe it would have motivated you.
Maybe. It's really an interesting thing. We don't always, Dr. Trinh talks about this all the time, we don't always do what we know we should do. We're little kids. I should eat better. I should sleep more. I should exercise. I should. And we go, yeah, but I don't. Is that because we're not motivated, we're not encouraged, or we're just not engaged, as you were saying, Dr. Tang here? We just don't, somehow we don't take ownership of our own health here.
I think it's probably all of those, and to some respect. And I think that to what Helen says is that our idea is that you can lead you can lead someone to the water, okay, but you can lead the person to an event. Can you actually engage them to actually continue doing it?
Right.
So, so we have to find a way to some sort of incentivize that particular individual to do something. I'm similar to you. You know, I've joined a gym and I've literally been there maybe once a month at most. But I go when my friend goes for sure.
Right.
And then if there's more of a community, more of a socialization or possibly even a gamification of that event, where there's like competition or you see other people doing something, then it's your buddy or your friend, and there's more of a chance you'll do it. So again, gamification or engagement is something that our MedV token is designed to promote. So imagine, if you will, you go see your doctor and you for a well visit, and then you get immunizations. Well, you should be rewarded for that. Yeah. You know, physicians are rewarded for metrics or health metrics when they provide care, but why are the patients not rewarded for that? So they should be rewarded for healthy choices, engagement with the healthcare community, and also changing lifestyle choices. So if you integrate like wearables or technology and sensors, you can be more impactful in terms of their day-to-day activity.
Well, one of the choices that Elaine had to make is between staying here or going to another meeting. We sent her to the meeting instead here. We'll carry on without her here. I am just fascinated by this idea of treating health as a conversation and not just a reaction. I normally don't think about my health too much, I'm sorry to say, until something goes wrong. And then I research it and I worry about it and I wonder, and then I fix it. I get the surgery, I get the pill to reduce my cholesterol, I do something, and then it goes back on the back shelf. It's not something we talk about every day. But you don't moan about how you feel. You just mutter on, in my world, the way I was raised. Health wasn't part of the daily discussion. Is that what you're trying to stimulate, Dr. Trinh? Make it more of an ongoing, important thing built around a community and not just a solo once in a while thing I focus on?
And because health is not part of the daily discussion, we become reactive to the health conditions that we develop, as opposed to proactive in preventing these health conditions. And the point of having a community come together is that, just as you say, when you're alone with this gym membership, nothing happens.
Right.
But when you have somebody who can go with you to the gym, something happens. And there's a higher likelihood that you go to the gym together. So this community is a community that comes together to encourage each other and to promote health together. Behavioral change works best when there are two components that are attached to it. The first component is support. The second component is accountability.
Yes, right.
And when you have a group come together, you have support. And when you're seeing others in the group doing the lifestyle activities, the nutrition, the diet, the exercise, it helps to kind of keep you accountable to doing your part as well. And it's why we get personal trainers, right?
Yeah,
many of us pay for personal trainers simply because there's somebody waiting for us at the gym to show up.
Yeah, I know you have a personal trainer and he holds you personally accountable. You go to his house
Absolutely.
Or his garage or something.
I go to his garage and I work out in there. And if he wasn't waiting for me at 6 a.m., I would never show up to work out. Yeah. So that's where the accountability comes in. And so we hope to provide through MDDao these missing components.
Now, one of the other ones that strikes me, and let's talk about this for a second, is membership. You know, most of the social mediums have no membership. That's what attracted us. I can use YouTube for free. I can use Facebook and Twitter and all these places for free. I think it's free. I'm really surrendering my data over to them. People don't understand that they're getting something out of this. More than just the advertising revenue. They're getting to track what I do and who I am and a lot of data that they sell to people, which we're always incensed when we find out. But because it's free, we freely give over this information to them. You could have done the same. This could have been a free platform. But I find that the things that are free, I don't value much. I have no investment in it. I have no stake in it. And you want people to feel like they have a stake in this space. Literally, plant your stake right here. This is your corner. This is your space in the metaverse here, right?
Absolutely, and we know this, Paul, through events, right? Like, for example, this coming event next week, November 9th, the future of healthcare. There's a cost to it. Imagine if it was free and anyone can sign up, versus if you had to pay for it. If it was free, people don't show up because it was free. If I had to pay $5, $10, $15, you bet I'm going to be there.
Because you've invested. I see that all the time. Something that's free, and I say, oh, that sounds fun, a webinar or something, but I'm busy, and I have nothing invested in this. But somehow if I've made a commitment, and in some cases it doesn't have to be a big commitment, $10, $5, whatever, suddenly I feel like, well, I don't want to throw that away. I don't want to waste that. I already invested $5, $10 in this thing here. I guess I better go. So there's some feeling of commitment. There's some feeling of ownership in this thing. And now you're offering people not just a fee to enter. It's $15, it's $50. I don't know. What is it to join the MDDao? I don't even know right now. If I'm a consumer, what's a Dr. Tang? It's
$75.
$75.
And is that one time or every month or every year?
Lifetime membership.
Lifetime. Okay, so for $75 lifetime membership, I'm in. But it doesn't just let me in the door. That's what I think is so unique about this thing. It gives me a say. It gives me a vote. It gives me some kind of, maybe fractional ownership's wrong because I'm never going to profit from this per se. I don't know if you guys, this isn't that where whatever the proceeds that come in are all going to be redistributed or something, but it gets me a vote like a condo complex as to what happens in our building here, right?
Absolutely. I think the most important thing is that it'll get you, like you said, it'll get you to vote. It allows you a voice, which is, I think, so important in our generation.
So what kind of voices? Why do I need a voice in this space? I don't even know what to say. So you're going to hold a meeting and I'm going to say, I don't know, I have no ideas about how to improve my medical community, my delivery, my conversations. But if you give me some choices, yeah, I might react to that. That one sounds good. No, that one sounds crazy.
Yeah.
Is that it? I mean, do we have to educate people along the way here? If they're going to vote, they got to be educated. They don't know what they're voting for.
Well, yeah, it's a process, of course. And then, like as we said earlier, the initial process will be more of a discovery. So everyone has an opinion. Everyone has had their experience with the healthcare professionals and as well as the healthcare community. So we want to get that insight.
So few people. I'd be interested in a poll among your listeners now or later. But I'm an old cynical guy who has lost, maybe faith isn't the right word, but a feeling of connection with my medical providers. I don't really have one. I just go to a clinic. I'm part of a group, and I show up and kind of who's ever on call at that moment, and I listen to them, and I like them, and I think that they've got good people, but they don't really know me, and I don't really know them. We never talk. We don't have, and when we get in there, we can't talk too much because it's a real quick process. What are you here for? Here's my problem. Let's take a look at it. Let's look at your charts. Let's look at the data. It's my best guess. Try this. If this isn't working, come back and we'll try some more things. But it isn't really a collaboration. It isn't even a conversation. It's a fee for service. I need my tire rotated. Can you do it? Sure. Yeah. And that's a different. So I don't have a whole deep ingrained feel. People are saying, well, you, and the whole Obamacare debate, well, you can't lose your doctor. I don't have a doctor. And I wonder how many of us don't have a doctor anymore. I don't have that sort of partner in my healthcare. I have places to go, like the tire shop, that I can get my oil changed and my tire rotated, and I trust them maybe over the other tire shop. But that's about it. When I need them, I go get them. When I don't need them, I never come in. And when I come in, it's a quick exchange. Here's the problem. Can you fix it? It isn't a conversation. Am I abnormal? Is that the way the world's going?
I think be honest, I think I have the same experience with my own healthcare provider. So I don't think it's an abnormal experience. And I always go back to the fact that I'm a pediatrician. As a pediatrician, my job is a super easy job because I always have an invested proxy. So the parent is going to arrange for the patient to come in at a certain intervals, arrange for that patient to get their vaccines. They don't want to get their vaccination. They arrange for them to eat healthy, to exercise, to do all these things that he or she may not want to do. And then they hit the age of 18 and they literally don't see a doctor for like 5 years. And I joke about that, but it's actually very true.
Yeah.
And so we want to re-engage that population and make it more entertaining, more meaningful experience. And we want to be able to create a partnership. It's not only helpful for a patient to experience that healthcare partnership, but as a physician, it's more rewarding for me as a physician to have that partnership with the patient. So instead of just seeing them like every year for physical, maybe I should see them more often, just to touch bases.
And what has killed that connection with our doctor? I suspect part of it is it's become an assembly line, in my opinion. Maybe that's a harsh statement, but and they did that with the best of intentions, I think, to keep costs down, to see more patients, et cetera, et cetera. But you push me through in such a quick moment, it's hard to have much of a meaningful conversation or to feel like I got anything more than my tires rotated and my checkup once a year. It doesn't feel like something I want to go and do very often. And when I'm there, it takes place so quickly, I don't even know what happened. All that I know is my finger got fixed.
Yeah. I'm not going to ask you which finger. But anyway,
yeah, right. Yeah, well,
do you need a digital exam to fix it?
Yeah, exactly. I mean, when did this happen? Slowly over time, but I feel a disconnect between the medical care system. I think
there's a disconnect, and I think there's some physician. There's some issues in terms of like workflow. So it's not that they're not involved. I think physicians love their jobs, but half their job, if not 60% of their job, is actually something just logistics.
Yeah.
So just gathering information, charting on a computer. It's something that can be overtaken or assumed or offloaded towards like AI or some sort of technology can actually provide that care. And then allows you like more time to have face-to-face conversation and meaningful conversation with your physician. So I think using the metaverse or technology to offload some of that busy work that every physician does, I think that will increase the amount of time you have with this physician.
So if Dr. Trin's still there, I saw his video go out, so I don't know if he's still with us or not here. If not, we'll throw it back to Dr. Tang here. But
I'm still here.
Oh, you are? Okay. So let's pivot from the consumer. We focused the whole half of the show about me, why I should want a voice in my healthcare, why I should feel more engaged, it's more fun. It's a collaboration. It's a communication. It's a community. Come on along. We're going to give you a voice. You get to spend more time there and hang out with others. I get all that. Why do doctors want to go hang out in this? And I'll preface it by saying maybe it's because they're getting burned out on the way things are, having to crank through so many patients and so much busy work. Is this part of why so many we're having a shortage of doctors and healthcare providers, or they're dropping out of the system because they're burning out?
We do have a shortage of doctors. There are a number of reasons for that. At one point, a doctor and a patient actually had a relationship, a doctor-patient relationship with trust. And over time, we have lost that holy, that holy relationship that connected. Part of that is,
and I'll interrupt you for 1 second. So in my parents' generation, they were from the World War II generation. They've long since left the planet, but to them, the doctor was almost like, we're Catholic, so the doctor was almost like a priest. It was somebody they could confide in. It was a confidential relationship. I don't know. Something's not working in my life. Something's not working in my marriage. Something's not working with my kids. There was a whole range of discussions they would have with their general practitioner, Dr. Welby, on the TV show. And they got to know them in a very intimate, I would say it is kind of a sacred space.
Sacred space.
And it had that kind of confidentiality that my parents once felt with the parish priest, which I don't think they have anymore either. A place, space they could go and open up and tell what they're afraid of, what they're worried about, what's happening in their life, and somebody would listen and maybe help them along. And then even communicate. We used to have the priests over for events, family functions or something. We'd have the doctor, your family doctor was a friend, and he'd come by for the 4th of July barbecue and stuff. Those days are long since gone. I don't even know who to invite, and I don't know that I wouldn't invite the guy that changes my tire to my family functions, and most of you guys are just changing tires now. To me,
absolutely, and it's not blaming it on the doctor. It's a system.
Yeah.
You graduate from med school, you join a large healthcare system, and you're told you got 15 minutes per patient. Right. So you're plugged into a system that is driving out volume.
Right.
You got to document everything. You're no longer looking at your patient because you're looking at the computer as they're talking.
Oh, that's maddening. As I hear the doctor's typing in his notes or dictating the notes if he doesn't want to type. See patient Roberts exhibiting something. And I'm like, hello, I'm in the room here, talking about me like I'm not even there.
That sacred relationship is lost. A lot of that is due to there's a lot of inefficiencies in our system, right? When I ask a patient from the beginning to the end in creating an appointment with a doctor, right? It starts with a phone call. It ends up waiting. Somebody puts you on hold on the phone. And then you got to try to schedule. Then you got to try to arrange transportation. If you're older, you no longer drive. If you're work, you got to take time off from work. If you have young kids, sometimes you got to bring the kids along or look for babysitting. And then you get to the doctor's office, and then you're waiting some more in the waiting room. There's more forms to fill out. And
I gotta wait twice, because first I gotta wait in the waiting room, and then they put me in the room, and I gotta wait for him to show that anxious 5 minutes while I'm waiting for them to walk.
Absolutely. And then you go to the exam room, and then you're sitting there, and then you're waiting some more in the exam room. And then the doctor shows up, and 5 minutes later, the doctor's gone.
Yeah.
And so when I ask patients in this entire process of that initial phone call, making an appointment, and all the different waiting process along the way, and the inconvenience of driving to work or driving to the office, taking time off work, finding babysitting, finding transportation.
All that.
What is the most valuable aspect of that entire process? That most valuable aspect of the entire process is the 5 minutes with the doctor.
Yeah, that's what you're going for.
What we want to do is we want to create a healthcare system where we recognize that the value of the healthcare visit is that 5 minutes. And the only way you do that is if you cut out everything else. And by cutting out everything else, it's virtual care, right? You're at home. You don't have to take time off work. You can do your visit at work if you're in a secure, quiet area. You don't have to find babysitting. You don't have to find transportation. You're no longer waiting because you're told to just log on at this time. The doctor logs on, and not only do you spend 5 minutes, maybe you get more than 5 minutes. Maybe you get 15 minutes, 20 minutes, 30 minutes with the doc, because you've cut out the entire waste in that process.
And maybe there's a dialogue. So in other words, I tell you my problem, you tell me what you think. Then there's an opportunity to come back and say, this isn't working. I don't know. This isn't happening. I don't have to go through that whole long thing again to spend hours to come in and get another 5 minutes in front of you a month later. A week later.
Which is what's happening now. And that's why we've lost this sacred relationship between the doctor and the patient, because the doctor's put into a system that drives volume. see a lot of patients, and and it's not necessarily a system that's designed by the doctor. It's a system that's designed by somebody else with a different motive in mind.
And it's corporate driven, it's profit driven, it's time driven. I get that, but it's also been governmental driven because they're trying to contain reimbursement costs if it's Medicare and other sorts of things. So they're trying to limit. And their only way is, well, the doctor is expensive, so let's limit the time you spend with the doctor, and let's therefore put a cap on expenses here. Now, Dr. Tang brought up something I never thought about. There is one exception that I can think of in this world where there is still a relationship, where there is still a conversation, where there is still a feeling of connection, and that is with pediatric care. My daughter has 2 great kids, my grandchildren, and she's moved out of our home in our area into another area in Orange County, but she still comes back here because the doctor she established a relationship, this woman in this case, she feels a connection with, and she'll drive here to continue that. And this woman has seen them since they were born, and she feels sort of an urgency to continue that care and continue that conversation with the doctor that was there and delivered them, or was there and started treating them at an early age. There is more of that connection there. That's an interesting thing, but I wonder what happens when they turn 18 and the pediatric gets turned over to a family doctor, and suddenly nobody goes. Yeah.
Well, it's hard to create a relationship where you only see your doctor once a year.
Yeah.
Or you only see your doctor when you're sick. And then, but as a pediatrician, like as I mentioned, we see patients often. Like the first year, we see them probably 8 times. And then during the course of the year, we see them, we answer questions. We do a lot of guidance in terms of like preventative care, which is something that I think adult doctors should focus on, and healthcare should focus on more preventive care.
So I would go see the doctor, and he wouldn't start by saying, "What's wrong with you?" He'd say, "Well, what's right with you?"
Yeah, exactly. I always say, like, "How are you doing? How can I help you?" And create a conversation, create a partnership with your patient. It's not only rewarding, like I said, for the patient, it's really rewarding as a physician. There is a burnout, an increase of physician burnout, and part of it is that we are feeling a little bit disconnected with our patient.
So do you think that your hope is, I'm sure, that doctors will embrace this metaverse as much as the consumers will? The consumers are hungry for a conversation. The consumers are hungry to make it fun, and a community to hold them accountable and help them along and give them information. I don't doubt that at all. I feel that. I just wonder if doctors are going to go, I'm not wasting my time in there. I don't have the time to waste in there. Or are they hungry for something new too? What do you think, Dr. Trinh? We'll start with you.
No, absolutely. There's a hunger for health and wellness that is not fulfilled today in our health system, because the doctor literally has no time to discuss health and wellness. They only have time to discuss about illness and sickness. Right. And so we have to move that shift over, and that's one of our major aim in this organization that is launching.
We have to get away from, maybe this is too harsh a way, but this surgical approach to medicine, where everything is highly specialized and highly focused on this one problem in front of us. We're going to fix that artery, and then the rest of it can take care of itself somehow here. Why it got clogged, I don't know. But I'm going to go in and flush that thing out and fix it because there's a crisis right now. And we tend to view medicine that way, in a crisis mentality. What do you think, Dr. Tang? Is that part of the problem? We're not thinking of it. We only think of it when there's a crisis.
I think you're very on point. I'm not sure if you're a physician or not. But,
I play one on television.
I can see you're very handsome. So I think that is actually true. And I think that traditionally healthcare is more reactive. So we basically see patients when they're sick and when they come in because they have to come in. We have to change it so we actually see them on a regular basis and create that partnership, as I mentioned earlier. Imagine, if you will, if you can prevent 5 people from developing obesity, what kind of
or diabetes or
diabetes. 5 people being obese, it'll affect diabetes, it'll affect joint problems, high blood pressure, morbidity. There's so many things that in the future that it'll actually decrease. and that actually will offload some busy work, some work for the physician in the future, because he won't see as many patients with diabetes. He won't see many patients with chronic care. So it'll be changed that way. But we have to engage that population, and that population is literally the 18 to maybe 30-year-old population who literally do not see physicians, and only see physicians because they have
I went 5-10 years in those years between seeing it. It's the only thing that's brought me back is this feeling, I guess I got to get a physical as I get older. Other than that, I try and never go to a doctor, and I'm not alone. Most of the guys I know never go to a doctor for anything, even when they feel sick.
Yeah, let's engage that population. Let's do something to sort of make it more impactful, more meaningful, so you actually see your doctor, because it's a fun event and it's an informative event, and it's something that you both look forward to.
And maybe we do it in outside of just office settings. I talk to my accountant once in a while. We have lunch, or I have an attorney that occasionally I've used as a friend of mine, and or my insurance guy. Occasionally we'll just shoot the breeze, or not a lot. I understand they're busy and they're not getting paid for those times, but sometimes they're willing to invest in building that relationship outside of the office. Let's have lunch. Let's play. I don't play golf, but sometime we'll go play golf or something, or whatever. Something that you somehow feel more of a connection to these people. And in that, they're going to say, hey, what do you think about this? Or what should I be doing about this? You got any ideas on this? And they say, well, let's set up a time and talk about that. But here's my quick thoughts. I don't get any of that in the medical profession. It's pay for play. And the clock is running the minute I walk in the door.
It's true. And then if I ask you to shave, okay, and I'm not your friend, okay, are you going to do it? No, okay. But if I'm your buddy, or your really good friend, I say, like, I want you to shave, okay, and then well, I'll think about it, sort of thing. So people.
Everybody wants me to shave off this grandpa beard here, but that's all right.
I like your beard. I'm Asian. I can't grow a beard. It's sad.
So let me bring up, and I hope this doesn't offend you or anybody listening here, but I'm told that in Asia, you're both Asian backgrounds here. I know Dr. Trin's Vietnamese. Is Tang a Vietnamese name to them? Chinese. Okay.
Yeah.
So the point being that in Asia, medicine is viewed differently, I'm told. When you look at traditional Chinese medicine or traditional forms of medicine, in that you see the doctor to not to get sick. And if you get sick, they have failed. They have done something wrong. Whereas today, I only see them when I get sick. It's all about fixing the problem afterwards. Is that an overstatement to the difference between traditional Western medicine and non-traditional Asian medicine? Even, I don't know, different sorts of health practices around the world here?
So my only experience with Asian medicine is from my mom and dad.
Okay, all right.
So I grew up in Canada, so it was a very Americanized or Canadianized system.
Right.
But I know that from in my interaction with my parents is that it was always more of preventative care, eating healthy, exercising, taking herbs,
acupuncture and acupressure, and getting your chi flowing.
Exactly, to prevent certain things, not sort of to treat it. Right. And literally as a kid, I never took any medicine, like never. I never took an antibiotic until maybe in my 30s or 40s.
Wow.
So it was always like preventative care, herbal medicine, taking ginseng on a regular basis to prevent certain things.
Right.
And then just adopting good habits in terms of eating like more vegetables and fruits and stuff like that. Just from the get-go, my parents were like, just that. And I always followed that.
What did you see? What do you know Vietnam better than that, Dr. Trinh, even though you left as a little kid, but you go back quite often, you have family and stuff there. Is it a different approach, or have they just adopted the Western medicine approach? Or is that one more thing we're exporting around the world here, along with cowboy movies and space movies?
I'm sure, yeah.
Yeah, well, as medicine gets westernized, we are looking for a pill that matches a problem.
Yes.
And that's part of the problem, actually, of Western medicine is I have a problem, what's the pill, right?
Solution in a very Western approach. What's the problem? What's the solution? Very science-based approach, yeah.
In Asian or Oriental medicine, the body is looked at with a holistic viewpoint. of
there's energy flowing through your body somehow.
Energy flow of wanting a state of balance.
Yeah.
In the Chinese yin and yang symbol,
right?
You got that circle with the little squiggly line in the middle, and you got the black and white yin and yang. And anytime you got more yang than yin, you're in trouble, or more yin than yang, and you get into a state of imbalance in your body, you get in trouble. And so the whole platform of Oriental medicine is balance.
Right.
And so we don't just look at your liver or your kidney or your blood sugar. We don't look at one or two parameters. We look at the entire body, and our goal is to get that system, that body, into a state of balance. And so it's a lot more holistic approach than a pill for a problem.
So it seems like we'll end with this, that the MDDao, this decentralized autonomous organization, which also to me smacks of Tao and the Oriental concept of Tao, of being in balance, that it offers people a chance to rethink how we think about medicine. Is it just a pill for a problem? Is it pay for a procedure? Is it a conversation, or is it a lecture? Is it you're telling me what to do, or we're talking about what to do? And do I have a connection with just one person or with a whole community? In many cases, I hate to say it, I get more information today out of the nurse practitioner or what's the other level that they have? The physician's assistant. I sometimes think they're more in tune with me and in touch with me than the mysterious doctor who floats in and floats out in 5 minutes.
Absolutely. You're right. And it's a problem that we want to address with this movement.
Well, it all starts by coming out and hearing about this thing for a nominal, I think you got a discount code somewhere here. Where do they have, if they want to get the discount code, where do they go to get the discount code? We want to be as cheap as possible here for this event next week.
It's MDVIP. One word is the discount code. It gives you 50% off.
MDVIP, and you can go to the Executive Next Practices.
Yes.
It's enpinstitute.com. enpinstitute.com. Look up their events. This is Healthcare Next Practices. It's happening next week, November 9th, from 5 to 8:30 in the evening. So no excuse. You don't have to miss work. Come out for 3 or 4 hours. There is a who's who panel of people speaking, including our guest today from MDDao, and including, I would be remiss if I didn't plug our great Chief Innovation Officer here at UCI and the Executive Director of the whole building that I'm in, UCI Beall Applied Innovation Center, where they really are trying to come up with innovation and apply it to practical problems here in the world, to take stuff from the research academic world and turn it into something. Errol Arkilika will be there as well. He's the Chief Innovation Officer for the whole university. And the fact that he's there says a great deal about the panel that they've selected and their feeling that these really are the innovators in the space. Elaine, Dr. Trinh, Dr. Tang, all the co-founders of MDDao will be there, and all these other people we mentioned as well. A fascinating panel to hear about a fascinating subject. Can we reimagine? Can we rethink healthcare? And that's what this thing is, the Healthcare Next Practices.
Absolutely. Thank you so much, Paul.
Thanks, Paul.
We'll see you then. All right. Thanks so much.
Bye-bye.
Bye.
Well, there you have it, folks. One more great reason to tune in and hear about what's happening today and tomorrow. And be sure and go get your tickets. General admission, $55. There's a discount ticket code that we gave you earlier for about half that. For next week's Healthcare Next Practices here at UCI's Beall Applied Innovation Center, 5 to 8:30 at the ENP Annual Healthcare Next Practices Meet Up event, whatever we're going to call it. All about the Metaverse and other innovative spaces taking place. Check it out. Join us.